Good morning, everyone. I'm Megan Cullip, and I'm here along with Scott Micklin.
Good morning. It is Thursday, April 30th, and we are here with our COVID-19 local community information program.
That's right. I think that this is the 7th week of quarantine, so I think this is the 7th week of the show.
You know, it may be.
But we're not counting.
Or could it be the 6th week of the show?
It might be.
Because we started it after spring break, you know.
Yeah, but so did in quarantine, I think?
We'll look that up. We'll have our researchers look into that.
We'll have my personal algorithm.
Which would be either Megan or Scott.
Right,
because we have no staff. I just want everyone to understand how low budget this show is.
That's right, because we're listener supported. So we want to make sure that they know that we're slim pickings.
Yeah.
You're getting a lot for your dollar.
Yeah.
So
everyone involved in the making of the show, you're seeing them right now.
You're seeing right
here we are.
Anyway, so I do want to, we'll figure it out because but I feel like this is indicative of the fact that we can't keep track of what day or date or.
We've just been doing this and that's how it is.
Right.
But
anyway,
that's okay.
Where are we? Anyway.
Right. If it is Thursday, that's why we give the date at the top of the show.
Yes, that's right.
So everybody knows where we are. And today on the show, we do have a great interview with two doctors from San Juan Regional Medical Center. Mm-hmm. I know it's one of your highlights of your week.
It is probably the highlight of my week.
Right. Besides talking to me, talking to them.
Right.
Right. So there you go.
Yeah.
So you asked a lot about, we're going to find out about testing.
We're going to find out a lot of things. Treatment.
Yeah. So
temperature and seasons, as well as just current updates, of course.
Yeah.
With what they're seeing.
We like to get that from them
because
they're on the front lines, literally.
Oh.
So that's
they know what they're talking about.
Exactly. And then we have some numbers,
of course,
that we can share with everybody. So let me get that.
You want to get that pulled up?
Pulled up here again. This is your staff. This is what we have.
Yes. So national news, which will segue into local news. So the number of unemployed Americans today, 30 million.
Right.
So that's a 3.8 million increase from last week.
Okay.
Which leads to the local news, which is that there are many places around town that are stepping up their food bank. So, of course, we have ECHO, and always a shout-out to ECHO because they're our primary food bank.
Right.
But also, there are local religious organizations that have a food pantry. Obviously, First Presbyterian Church being one of them. For example, that you may know of
one, right? Exactly.
But also...
But you were fully stocked, right? And that it kind of comes and goes, right?
We do. We were fully stocked like about a week ago. That was completely drained, and now we're fully stocked this week.
Okay.
And so that's just a special gratitude because folks in the community who are not hurting right now are stepping up and helping those who are. And then I got a phone call yesterday that the Pinion Seventh-day Adventist Church is also having a food bank. Pinion Hills is having a food bank.
Good. So I think if folks are in need, they can look around and probably find out near them who may be able to help.
That's right.
And a lot of these, like yours, I think, is kind of a no questions asked. You don't have forms to fill out. There's nothing of that stuff. You just show up and and tell what you need, and they try to accommodate you.
Yeah, and we have bags, for individuals without homes. We have like what we call a snack bag, which is just proteins and stuff that you can eat without cooking.
Yeah.
And then those who have an access to, stove and et cetera, get a box. So,
Very good. I do want to acknowledge our viewer in Hawaii. Oh. Thank you for saying good morning, or it's 5 a.m. I don't know why you'd be up at 5 a.m. in Hawaii.
Thanks for broadcasting online, and nice to see you, Scott and Megan. Do we know them?
I don't know.
I love it.
But we'll find out.
Yeah, I'm going to look later.
Aloha.
Yeah, aloha, seriously.
Nice to have you joining us from
Hawaii.
What's
the weather like over there?
Stay safe and well in Hawaii.
That's right.
A place that I have yet to visit.
Me too. Yeah, I don't know if I'll ever make it.
Well...
We'll see. Okay. Probably the price of airfare right now, which is not a risk we're willing to take.
I imagine they might pay you to go to Hawaii these days with the price of airfare.
Yeah, exactly.
Anyway. All right, let's take a look at numbers, right?
Shall we take a look?
Yes. That'll sober us up right away, I'm afraid, because the numbers are a little high. 239 cases in New Mexico yesterday, so we're above 3,000, 3,000. 68 new cases in San Juan County yesterday, so again, we're above the 500. And so...
I see that.
Okay. And then in New Mexico, we had 2 additional deaths yesterday. No new additional deaths in San Juan County. So, yay for that.
Yay.
That's, some good news. And we've had 29 new recoveries. So there's that.
There's also a yay.
So there you go. So that's where we are. And then if we scroll down, we can see the number of Navajo Nation cases. Again, they had 104. Mm-hmm. 2 additional deaths across the Navajo Nation, so their totals is now 1,977.
That's
across the Navajo
staggering.
Nation. Again, the plug about another 57-hour weekend curfew will start tomorrow at 8 p.m. Until Monday at 5 a.m. So there's that. And that's the daily statistics. And then, of course, the big news yesterday about the cancellation of the Connie Mack World Series.
Oh, my gosh. Which is a big deal. That's a big deal. That rocks this town. I mean, this is a tradition.
Yes.
I mean, the second I moved here, it was maybe the week of Connie Mack, and that was like the first thing people took me to.
Oh, well, yeah.
They're like, you have to experience Connie Mack.
Right. And now you understand.
Oh, I love it.
Why it's
and
such a huge thing.
I got to work it last year, and it was so exciting. I loved it.
Nice.
Yeah.
Well, we are sad that has been canceled, but we understand the reasons why. In fact, we're working to get the general chairman in to talk about that, maybe on my show next week. So fingers crossed that Tyson will come talk to me. So we'll see.
Tyson will come talk. Fingers crossed.
Yeah. Well, I'm just saying.
And it's important to point out, of course, that we had 1,000 new test kits on Sunday and Monday that were performed on Sunday and Monday. And so part of the increase is undoubtedly related to increase in testing, which, as you'll hear the docs and as everybody else is saying, is par for the course.
Right.
So,
that's where a lot of these numbers
are. So it's concerning, but it's also
from.
like just common sense that this is going to happen. So.
Right. We also want to share some other numbers with the audience and another source of numbers, which is San Juan County, and a big shout out to them at San Juan County's website, because they've been compiling these local numbers as well, and we can kind of show that on the screen. As we look at, these are just daily cases since March 9th through earlier this week, April 27th, maybe the 28th is there. But we can see the number of reported cases, right? So for the whole state, it's kind of that magenta line at the very
middle, right, basically?
Yeah.
Magenta.
Right. Dark green is the Navajo Nation, lighter green is Navajo Nation in San Juan County, and then the blue is San Juan total for San Juan County. So you can kind of see how we've kind of dropped, then we're back up. And so that's where we are.
Yeah, there's definitely a peak and then a trough and then a peak, and I'm narrating this for the radio audience, of course.
Yes, thank you.
So, but also, Navajo Nation is a vast piece of land, right?
Oh,
so
yeah.
I wonder...
In 3 different states.
Right, so it's very helpful that they did a Navajo Nation and San Juan County line specific.
Mm-hmm. I agree. But there you are. But you can kind of see how Farmington and San Juan County is kind of following the state lines, because there was a kind of dip in the state numbers too, and then it came back up again.
Yes.
So, even though we are trying to flatten the curve,
it's not there yet.
But we're not there quite yet. And so I want to look at the next graph. So let's see.
I wonder if I'm going to look up if that is consistent with other states, that there is a peak, a trough, a peak, and a plateau.
Okay.
I don't know why that would be. I don't know, but maybe there's stuff out there for it. So
could be.
I'll get on that.
Okay.
Monday.
Okay. That's your homework.
That's my homework for the weekend. You know how I love homework that involves graphs and science and such?
I most certainly do.
And comparative graphs and science.
So if I go to this screen, maybe this will show us the other screens.
Maybe we'll maybe find somebody from the county to talk about this. Okay, go on.
All right, that's okay. This is cases for the Navajo Nation, San Juan County, and the state of New Mexico per 2 days. So again, it kind of shows, if you combine them for 2 days, what those numbers look like. So again, state of New Mexico, the magenta line, Navajo Nation, again, the dark line, which is way up again.
Way up.
Right, the number of COVID-19 cases. And then San Juan for 2 days.
Per day. Or per 2 days.
So you combine the totals,
right.
And that's why you get that 300 spike there at the Navajo Nation for this week, right?
But what is with that trough? That's like they went from 250 down to 0 for 2 days, and then
here's my thought.
Okay.
Because that's Navajo Nation numbers. I'm thinking they didn't report for 2 days.
This makes sense.
I'm afraid that may be what that is.
Yeah, I'm like, okay, that curfew is hola.
No, I don't think that's
effective. Okay,
right.
Got it.
I think that may be an
maybe it would
anomaly.
Have been maybe it was a weekend.
Maybe.
So they weren't in the office to report. I don't know.
We don't know. But anyway, but I think that's what that trough is, because that drags down. It's dragging down a lot of those lines, right? For those 2 days. They're all dropping.
You're right.
So, anywho, so there's that. Move on. Here's San Juan County. So again, Navajo Nation cases in the county and non-Navajo Nation cases in the county.
Okay.
So again, and then you have that flat line there, so that shows you, even though the county was still showing cases, the Navajo Nation was either not reporting or they were at zero.
Right.
For 2 days.
Right.
All right. And
not reporting makes a lot more sense to me.
Right.
Right. Agreed.
There you go.
Oh.
And this is cases per day. Here's the last
That's
one
really
I want to share with
interesting.
everybody, right?
Yeah.
And so as we take a look at the blue line, which is new COVID-19 cases, and then the yellow line, which are the deaths from COVID-19, that's what we're looking at here. So again, we dropped, then we're on the way back up. So
right, but also, again, narrating for the radio people, each point has a different number of cases, which is interesting to me. It's just very specific. That's
per
all
day.
I mean.
Well, it's per day, right? So the highest per day we've seen is 51.
Right.
And that was around April 20th, maybe.
Oh, right.
Okay.
Yeah.
And the most deaths we've had was maybe 6 right around April 25th in San Juan County.
That was a bad few days.
So there's that.
Okay.
Right. Anyway, but it's data, and it's something that we can look at, and we can compare ourselves to other places, and
that's right.
That's what we've been doing as well. And of course, our thoughts are with folks on the Navajo Nation and here in San Juan County. And I have to talk about McKinley County because they're a smaller county than we are with Gallup and McKinley County, yet they have almost double the number of cases that we have here in San Juan County.
Yeah.
So I'm concerned about that.
Yeah, we should be.
And so our thoughts are with them
as
well, to try to really, again, try to stay home and wash your hands, don't touch your face, all those things.
Don't touch your face.
Right.
I'm improving on that.
We haven't gotten as many comments from our listeners and viewers about your face-touching habit.
My face-touching habit.
So
no, it was good. They set me straight,
Good.
Yeah.
Whatever it takes. So that's
Takes
important.
a lot to set me straight, but
right. There you go. Anyway, let's get to the doctors, shall we? Right?
That'd be great.
Here we are filling time, and we don't have to because we have the doctors to
we
talk
have the
to.
docs. Let's do it.
And we want to talk to them. Give me just a second.
Okay. Here we are.
As we want to talk to them,
time.
but yet we have to wait just a moment.
But
we're going to talk to them right now. So here we go. I would call them 2 of our favorite doctors from San Juan Regional Medical Center.
I think so.
Are
they
coming
went,
up on the program. Here we go, everyone. Joining us to give us an update on conditions at San Juan Regional Medical Center and to answer some of our questions, Dr. Brad Greenberg and Dr. Aaron Philpott are on the phone from San Juan Regional Medical Center. Doctors, good morning. Thank you for joining us. Megan is here, and I know she has a lot of questions for you, so we could get right to them, I think.
Yeah, great. So we actually talked about testing the last time we chatted. We talked about the rapid diagnostic test and then the antibodies test. And I think there's been some updates on that constantly. And one of those, though, is there's this concern about false positives. Can you guys speak to that?
Yeah. Well, first off, thanks for having us again. We appreciate the opportunity to get more information out there. There is, as you mentioned, a lot more information coming out in regards to the antibody test. The Infectious Disease Society of America put out kind of a statement explaining how to best use it at this point in time, which we kind of touched on last time with the basic evaluation of how many people in the community have been infected previously by looking at the antibodies. The tests are imperfect, as you mentioned. We're concerned about the possibility of false positives, so them having poor positive predictive value. And basically, the test, it's pretty complicated, but depending on your what's called pretest probability or your likelihood of having the infection, it affects how accurate the test is. So the other issue is, so it's going to be different in different communities across the country based on how much COVID-19 they've had in their community. The other piece to the test is they're not well regulated by the FDA. In fact, they're not regulated by the FDA. And the government has put together a coronavirus task force that has put fairly loose criteria to sort of monitor or regulate these tests and these testing services. So while a negative test is helpful, meaning a negative antibody test will say, no, you have not been exposed to the infection, a positive test doesn't necessarily 100% mean that, yes, you've had COVID and you're good to go. The other important piece to that is we don't know if reinfection is possible yet. There's a lot of cases in South Korea that they're looking at right now, and it looks to be people in their 20s and 50s who had initially had COVID-19 and then are developing symptoms later and testing positive for COVID-19. And we don't know if this is what's called reactivation or reinfection. So point being, with the antibodies testing positive, we don't actually know if those positive antibodies are protective against getting COVID-19 again. So still a lot is yet to be figured out with that.
Great, thank you. And somewhat of a follow-up there. It seems like the holy grail here is the vaccine, but there's questions about, so you have treatment on the road to the vaccine, as that is continuously, they're working on developing that. And one of those treatment options that I've heard about recently that I'm super fascinated by is this plasma donation, where survivors of COVID-19 can directly give their plasma to folks that are currently fighting it. And can you speak to that? That is a fascinating possibility.
Yeah. Yes, I completely agree. I think so. Convalescent plasma, which is basically part of your blood, excuse me, is so it's part of the blood product that people who are exposed to COVID-19 can donate plasma. And the idea behind this is they have antibodies in their plasma that may help fight the infection if given to people who are actively sick with coronavirus. We at San Juan Regional are in the process of enrolling with the Mayo Clinic to offer this service to our community. So we will be recruiting or requesting donors in the future who have had COVID-19, who tested positive for COVID-19 and have recovered from it. And generally, the donation period is not until 28 days after the positive test. But we will be getting out more information to the community in upcoming weeks on how people can donate. As far as the response to convalescent plasma, we don't know yet. It may be helpful. It's demonstrated to be helpful in other diseases like Ebola to help people recover more quickly. There was a small case series out of China that did demonstrate benefit. So we're hopeful that this will be something that will be useful and may help our patients in the future.
That's super exciting. So switching gears a little bit about viruses staying in the air or on hard surfaces, there's been a lot of talk about phasing in, and one of those prospects is, for example, schools might have half of their student body come on Monday and Wednesday and the other half come on Tuesday, Thursday. And so the question is, how long does this virus possibly stay in the air? How long do we think it stays on hard surfaces? That seems to also be updated pretty frequently. So can you speak to that?
So I think so they've done different studies looking at how the virus aerosolizes or how it goes up into the air and hangs. And that's kind of the aerosolization piece versus the droplets where, like you have a little spit or a particle that goes out and sticks. So as far as the aerosolization piece, I don't know any of the latest research as far as how long they're finding it in the air. The big thing is what induces aerosolization. And we think, sneezing and coughing probably does a little bit. We are much more focused on that here in the hospital with infection control with different procedures. But I think the big question is, the distance, like how far apart kids need to be, number one, for that aerosolization piece. And then number two, in general, how many kids are actually shedding virus or, potentially transmitting it that don't have an active infection or symptoms happening. As far as the fomite or sticking to surfaces, some of the studies have shown up to 3 days. The question is if the virus is actually active and transmissible for that long. And I haven't, these are two things I haven't recently looked into, but earlier on, the study designs didn't necessarily consider, is it actively going to transmit infection at this 3-day period, or is this just virus that's still there but doesn't have the capability of doing that?
Yeah, there's a lot of things that we actually don't know still. And there are a lot of questions, especially as we'd like to plan for the fall or for summer school or to try to get back to something that looks like a normal pace for students and children, for adults, in really any setting. And, the ranges for these things existing on the surfaces throughout the duration of this particular event, there was concern about anywhere from 12 hours to 9 days, and then there was also still some unknowns that are definitely affected by study design. About one of the cruise ships at like 14 days still had detectable virus. So there's a lot of science that still needs to happen, and it's likely that that school and the way we go back to school and how kids go to school and where they sit, it might look a little bit different in the fall. But I think that we'll try to learn everything that we can through really good science and make good decisions so everyone can get back to something that looks a little bit more normal.
Great. And speaking of the fall, there's this, so we all know about flu seasons, et cetera, and we hear talk all the time about viruses being less active in the summer. Is that something that we think this virus conforms to, or is this a different bag of tricks altogether?
Well, unfortunately, we don't have a great answer to that question. It is a great question, but I think that we'd like to think that the warmer weather would perhaps reduce either the transmissibility or the virulence or the communication of this virus. But we don't know how to answer that question. We do know that the virus has been active in warmer climates, either near the equator or in the southern hemisphere, during the same time period, even while it's cooler up here in the northern hemisphere. So we really don't know what's going to happen with this summer. We sort of hope for the best and plan for the worst. Now, as it relates to this whole viral picture being compounded or made more complicated by either influenza or respiratory syncytial virus, we are definitely concerned about that. I mean, the idea that we could take a coronavirus and COVID-19 clinical syndromes and then compound them with influenza really does represent a challenge for us to try to discern between those two things, and then how does it change what we do and how we provide care and create a safe environment of care in the hospital. So we're hard at work trying to think about those things. We think we have a few months before flu season is really back in the swing, but we have similar concerns, but unfortunately we don't have all the answers.
But you have a lot of them, and we appreciate that, doctors, of joining us for sure. But I know that's what concerns a lot of folks in your line of work, is maybe the second wave, or as you mentioned, we're trying really hard, a lot of folks trying very hard to flatten the curve, and we know this virus is around, we know it's hitting our communities hard, but we don't want to overwhelm those of you that are on the front lines at our hospitals, and when you add that plus just regular old flu cases, folks are concerned about that, and that's what you're talking about, correct?
Absolutely, and I have to say, again, and this is something that I feel like I say all the time, but I do believe that the impact on the healthcare infrastructure right now is what we would consider something that when I say we, I mean the entire state of New Mexico, is in a position to handle. But that's not luck. That's a product of all the hard work of all the people that are in the public, everyone that's heeding guidance about social distancing, everyone that's making really good choices. And it's really important that we really continue to follow the guidance. I think the governor's been very prudent and forward-thinking about how the state of New Mexico can best respond to the COVID-19 pandemic. And, I think that we in medicine have a lot of concerns about the reopening of society in a manner that may increase potential cases, and we have concerns, and we see the world through a specific lens. And we also understand that on the other side, there's a lot of pressures and impetus to try to build the economy back up, and there's a lot of challenges and things to balance. And it's a difficult decision for a lot of our policymakers. But I do think that we need to continue to make really good choices, continue to the degree possible, heed social distancing guidelines, and also as it relates to, and the White House even put out universal mask guidance where they wanted folks to, when they're out and about, to wear masks. And I think that we need to continue to do those things to try to reduce the overall burden of COVID-19 throughout our society, within healthcare institutions and elsewhere. And because we're all in this together, but we're also into this together into what is kind of like the unknown. This is a new challenge not seen in modern history, and we need to continue to adapt and be really thoughtful about the choices that we make so we can reduce the overall burden of the illness.
I think that's good advice, Dr. Greenberg. And I know a lot of folks are certainly anxious to see maybe some businesses reopen, and certainly, for folks whose livelihoods are in a business that's had to be closed, and everyone, I think, can appreciate their situation. But as you said, even though our local healthcare facilities in our state and our community are not maybe overwhelmed, I know that you guys aren't just sitting around up there eating bonbons and waiting for folks to show up.
They might be researching while eating bonbons.
Perhaps they're doing that, but you're working really hard and really long days. I mean, and I know, I think I'm not wrong in saying that a lot of your folks and your colleagues are working very hard to make sure that you're not overwhelmed and to get sick people well again, right?
Well, absolutely, and I think that it's important to know is that, it is not that we've been unaffected by this. We are really significantly and profoundly affected by the COVID-19 pandemic, and we've seen over 100 patients in the hospital, and with COVID-19, we've had a whole range of folks in the ICU and out of the ICU, and we've had 19 deaths from COVID-19 in our facility. We've had presently we have a number of patients who are critically ill on ventilators in the ICU. 7 of them are in our COVID intensive care unit. And, we continue to really pursue what is the state of the art for clinical care in these areas, to try to make sure that all those folks that are at our facility and those folks in the Four Corners have the benefit of the best kind of clinical care that's available. We're not a tertiary care facility or a university facility, but we work really hard to make sure that we can do everything possible for those folks. And we also work with partners who are in some of those centers to make sure that folks receive optimal care. We continue, when we look at the testing, we've performed over 1,715 tests. And we continue to perform those tests. We now have, we have a mixture of tests that we continue to there are ongoing challenges with testing inventory and supplies, so we still work with our partners, the Department of Health, and also with our own laboratory to do our own testing. And we continue to follow data as it relates to the number of people who are presenting to the hospital with influenza-like illness or COVID-like symptoms. And we followed these issues as it relates to testing, influenza-like illness, and all these cases in the county and in the state. We follow them on a daily basis to try to make sure that we're on top of how things are changing in our community and in the broader Four Corners region. So there's a ton of work that's going on here to make sure that we can keep people safe. And so I think that it's really important, and we're very cognizant of it. What we're able to do here is a product of all of the guidance that the public is listening to and heeding as it relates to social distancing, isolation, covering your cough, wearing a mask. All those things, they all make a difference, and we feel really strongly that we hope that people make really good choices and continue to follow those suggestions.
Most certainly.
Yes,
go ahead. Go ahead.
I just wanted to add a couple more things to that. We've made a lot of modifications in our hospital to accommodate a larger number of patients. We went from our usual 14-bed ICU to 23 beds available for COVID and non-COVID patients. So we are seeing a lot of patients. Things have changed across the state on how patients are transferred in, and that's helped us kind of maintain this steady state of where we are and able to take care of our patients. So our county is still identified as one of the counties with unmitigated spread. And I think that's important to highlight. While we're commending everyone's efforts with staying home, some still are choosing not to. And I think it's important to recognize that we're still seeing an uptrend in cases in our community. So efforts still need to be made. And I think that's an important thing. And we recognize there's also hardships and of course, terrible economic things going on, and striking that right balance is important too. But from the hospital perspective, that's what we're seeing.
Certainly, and that's a good point. And I did want to mention, I didn't mean to make light of the situation for sure. And I know you're dealing with all types of patients at the hospital, some who are critically ill. But I think it's important to note too, as you mentioned, Dr. Philpott, that I don't think it would take much to have a surge of cases, and that may be somewhat overwhelming to our medical staff locally if you suddenly had a bunch of more very sick people showing up at the hospital. And so we've managed it well for now, but isn't that one of your concerns, is that it doesn't really take a whole lot to get it to tip us over the edge to somehow we have a bigger emergency?
Yeah, and I think so. Yes, that is a very good point. And I think what we're seeing, people keep kind of imagining this as tsunami of people, and it's more a slow rising tide. This illness is making people sick for many, many days, so they're in the hospital for a lot longer than we typically see with a lot of these illnesses. So, for example, someone in the ICU, it may be on the ventilator for 14 days. And that is not usual. Usually we can get patients off the ventilator within, 2 days to 7 days, depending on what illness they're afflicted by. But so that does really affect our numbers in the hospital. So even just a slow rising tide can cause hospitals to run out of resources. And that's kind of what they saw in Italy and New York and are dealing with now. So yeah, you're right. A big surge of people, or even just a slow surge of people, is what we still worry about.
So have you guys seen less cases that are other emergency cases, like less automobile accidents, less people coming in for other issues? And can you guys speak to that?
I think that in general, especially a few weeks ago, the answer was yes. We were seeing less of those things that we would normally see. That being said, in the last couple weeks, the non-COVID patients, the patients that have more what you would consider run-of-the-mill problems, we've actually had an increase in the number of those folks also. And it's become very important for us to make sure that we have enough space, resources, and personnel to take care of the non-COVID challenges, people that have things like strokes and heart attacks and car accidents, and we also see a range of other things, penetrating trauma, stabbings, and those kinds of things. We need to be ready, and it's very important for us, and we've postured our organization to be ready to take care of those things. So it's actually been challenging as we saw this decrease in overall non-COVID resources and then an increase in the number of COVID patients, but now we're seeing an increase in both. And we actually expect non-COVID problems, especially trauma, to increase over the summertime, which is a normal pattern. So we have a couple challenges here to make sure that we can allocate the right constellation of resources to take care of all the problems, not just COVID, but the other stuff too.
Right, so I'm guessing that part of the increase in the summertime is just more people want to be out and about when the weather's warmer, but do you think also part of this is that people are getting a little stir-crazy and a little lackadaisical and less vigilant when it comes to guidelines?
Yeah, I think your point's good. The social distancing or physical distancing might be also having sort of some unattended consequences or positive outcomes, if you will, of people not doing crazy stuff and really heeding the advice, which might change and loosen up a little bit. As you say, people are getting stir crazy. But that is something I was discussing with some colleagues over in Durango. Where are all our usual bread and butter hospital patients? And we're speculating why. Are people choosing not to come? Are people not getting their usual bacterial pneumonia because they're not out and about? Are they washing their hands more? So I think people are seeing it all across the country and are speculating why. But I agree with you. I think people will start kind of getting back to their normal routine as they get tired of this, and we might see even more, as Dr. Greenberg was saying, over the summer.
Interesting. Well, before we let you both go, and we appreciate your time, I know how valuable it is, I did want to ask about this testing event that we had here in San Juan County on Sunday and Monday out at McGee Park, and from what we understand, there was maybe 1,000 tests that the State Department of Health had brought up here to test some of those essential workers and other folks that maybe were living with someone testing positive and what have you. Are we expecting, or are you expecting, or have you already seen it, the results of these tests? I don't know how long the delay is from a test to when you get the results back, but are we expecting to see maybe more positives in our county? Not that they need to be hospitalized, but just that the numbers might go up here in the next few days?
I definitely think that, they did test about 1,000 folks, 1,000 or 1,100 or so.
Okay.
And the tests on Sunday, they actually completed them, and they were done on Monday, which was fantastic. And then the tests that were, I believe that they were done on Monday, I believe that they should have had the results yesterday. But we've already seen, when you test a lot more folks, especially folks that, and I think they advertised it to get folks that were symptomatic, but not necessarily requiring hospitalization. When you test a whole lot more people, you're going to get a lot more positive.
Sure.
And so I think that we've already seen that reflected in our data, but I do think that and I believe that there were 36 or so positives reported yesterday. So I think that the testing events, and when we start testing a whole lot of folks, we expect to see an increase in the number of cases. One of the things that we actually look for, though, isn't just the number of new cases, but it's the percent of the cases that are positive as a reflection of the total cases that are performed. And so we try to look at those rates of positivity as a better indication of what's happening with our local population. So, but we do follow all of that data, and we appreciate the Department of Health coming up here and holding a testing event here for our community.
Most certainly. And isn't that, Dr. Greenberg and Dr. Philpott, the way that we can learn more about hotspots in our own community, not just that San Juan County is a hotspot, but then knowing maybe that there's a certain part of Farmington or a certain part of the county that is seeing more cases, and if we're doing some of this contact tracing in the future to enable folks to maybe reopen some businesses or things like that, isn't that kind of the way forward with all of this?
Yeah, you have it exactly right, Scott. It is essential to reopen our economy, to have widespread testing availability and be able to do what's called containment. We're essentially in a larger mitigation mode, which are sort of the epidemiologic terms that help identify where we are in our efforts to curb the epidemic. But containment is essential in identifying those clusters and reaching out to those people, instructing them to stay home, self-isolate, and therefore stop the disease. So that will be very important going forward in identifying those people. So we hope to work with the New Mexico Department of Health and really come up with a collaborative plan, and that will be effective for our community to facilitate reopening and safe reopening, and while also considering sort of the spread of this.
Very good. Well, doctors, we thank you for your time. Is there anything else that either one of you wanted to add before we wrap up for today? I know you probably
like your
have
favorite bonbon, Twinkie.
Thanks.
What do you prefer?
Yeah, thanks for bringing that back up.
I just wanted to thank you both for having us back on to continue this important conversation with you guys and with the community about what's happening with COVID-19 in the Four Corners. And I think that this continues to evolve and to change, and we continue to try to adapt and everything, but it's so important, and we really appreciate the opportunity to chat with everyone and to get a little bit of the information out about what's going on our side, and so thank you.
You're very welcome, and the feeling is definitely mutual. I think I can speak on behalf of Megan. We appreciate your time, too, both of you.
I love it.
So, thank you all. Please stay safe, and again, extend our thanks to your colleagues who are continuing to do all the work that that they are doing at the hospital. So thank you very much. And there you go. The docs.
The docs.
Right? We love talking to the doctors, right?
We love the docs.
Great information, once again.
Yeah. I mean, it really is like stellar, up to date, and they really explain in depth in a way that like everybody can understand. And
right.
that can be hard to do when you're stuck in the realm of medical jargon all the time.
Exactly.
So,
and now we know that all those tests that were done at McGee Park are probably in the numbers that we're sharing.
That's right.
And so that's a good thing. And
that
as we've said, everybody talks about how much we need to know where this virus is, who has it, how it's spreading, the hot spots in a community, and so more testing, the better.
That's right.
Even if it comes with higher numbers.
That's what they say.
So we have to understand that. Anyway, all right. As we wrap up, you want to...
I have one interesting thing.
All right. Just one?
I know.
You're such an interesting person. Okay.
Cool. So the University of Chicago has an online magazine called The Point, which I love that title, by the way. Like, what is The Point? You tell us,
right.
You of Chicago.
And here it is.
And so right now The Point is doing a quarantine journal, and it's really quite a good read because it's basically 3 articles that are easy to get through, and we're on volume 20, which is just every time I read like a number, I think it's like day 49, you're like, so anyway, one of the articles I read this morning was called The Price of Normality. And it's talking about, so there was something going on called the Swedish experiment, and Sweden was very laissez-faire when it came to restrictions. And so this journalist is arguing there's some significant...
It didn't have all the lockdowns and the stay-at-home orders like we have here and in other countries in Europe, too.
Exactly, which the other countries in Europe were looking around, and they were a little nervous about this Scandinavian experiment. Mm-hmm. And what this journalist is arguing, who lives there, is that things really, They live
in Sweden.
Yes, they live in Sweden.
Okay, yes. Just making sure I'm on the right page
here. So she lives in Sweden, and what she's arguing is, A, some of the citizens are very frustrated with that, especially the vulnerable ones. They're trapped. And then B, they're showing now some consequences. Again, the cost of normality.
And this means they're getting more cases then? Is that what you're seeing?
Yeah, more cases.
And spreading, and it's community spread.
Right,
then.
right.
Gotcha.
So yeah.
Interesting.
So, that's just to say stay vigilant right now.
Right. Exactly. So again, everybody, we know the governor of New Mexico is going to be doing a press conference this afternoon.
That's right.
Which I'm sure will be covered everywhere, basically.
Right.
And there'll be new information about that. And so I know lots of folks are waiting on that. I think the assumption is that the stay-at-home order will be extended officially through May 15th.
Right, that's definitely happening.
But there'll probably be some other, hopefully, guidance about maybe a phased reopening in our state and how that's going to work, and maybe what the numbers have to look like to maybe trigger some of those things. Right. At least that would be my hopes, that they would be coming out with some of that information.
Me too.
Because I know folks are concerned about that. There's definitely economic consequences, but there's certainly health consequences too, as our doctor friends would tell us. So.
Significant health consequences, yeah.
Yeah, so there you go.
Cool.
All right, everybody. Thank you for joining us again on our COVID-19 Community Information Program. We are here Monday through Thursday at 9 a.m. And again, thanks to our radio partner, KNMI, who broadcasts this show Monday through Thursday at noon every day. And you can hear it on the radio at KSJE every Monday through Thursday at 5:06 p.m. every day. So there you go.
That's right.
All right. Have a good weekend. Stay safe.
Stay safe. You too.
All right.
And we'll see you guys next time.
All right. Wash your hands. Don't touch your face.
Don't touch your face.
We'll see you on Monday, everybody. Bye-bye.